speaking to Bethany, I realized that my knowledge with midwifery was lacking. Then I wondered, how could I further educate myself on obstetrics? So I went to Dr. Yolanda Taylor, an OBGYN that delivers at Women's Hospital, as well as in a joint practice with other obstetricians that take care of women and their gynecological needs. How would you describe your profession to somebody who doesn't know what an OBGYN is?
An OBGYN is a physician of basically women's health. That's probably the best way you can think of it. So I am a doctor who takes care of women with gynecologic needs as well as obstetrical needs. So I deliver babies, but I also see women that are not pregnant that need me. It is not, I don't do things that are, say, related to cardiology, but I may screen them for those types of conditions. Um, but I usually just do a core group of things for women.
Okay. So how much contact would you say you have with your patients?
A significant amount. But it also depends on what kind of patient we are referring to. For obstetrical patients, I see them very frequently because that is the expectation. So I may see them every week, every 2 weeks, or once a month, depending on their gestational age. For my gynecologic patients, I see them approximately once a year if they're healthy. So it just varies, and it just depends on what the need of my patients is.
Okay. Um, what is required education-wise to become an OBGYN?
Well, I went to college for 4 years, and then I went to medical school for another 4 years. Because I wanted to do OBGYN, the training is another 4 years. Um, that varies depending on the specialty, though, how long you train. Also, there are doctors who only went to college for 2 or 3 years. So, but the average is about 12 years total.
Oh, that's a lot of
That's a
years.
lot of years.
It really is.
It's
Um,
worth it.
really?
Yeah.
You would say so?
Yes, indeed.
Okay. Are OBGYNs required to have continued education hours? If so, what types of courses are offered?
Absolutely. We have to do, we call them CME, continued medical education. And it's usually just yearly. So you can do it several ways. You can go to a, let's say, an annual meeting. You can go one meeting and get as many credits as you want and just do it in one foul swoop. Or you can attend seminars and meetings that may say maybe an hour, but there is a minimum, and that will depend on the hospital that you are working out of. There is a minimum that you must complete every year in order to maintain your privileges and maintain your skill, because you want to make sure that you are up on the latest information all the time, because we want to
Things
provide,
change all the time.
absolutely, and you want to provide the best health care possible to your patients.
I understand that completely. How much of the actual birth does an OBGYN attend?
We attend the, okay, so when a woman comes into the hospital, there's a labor process and then there's a delivery process. That's why they call it labor and delivery. During labor, the doctor does not sit in the room the whole time. So, um, for example, I will come in periodically during the labor and check on my patient, make sure everything is going okay, make sure the nurse doesn't need me for anything, make sure the patient doesn't need me for anything. And then for the delivery process, I am there the entire time. I may not necessarily be there when she is pushing the whole time, but from the time they're complete, I am on my way. So that we'll, and from the time the baby is until when she pushes the baby out until everything is done and she's settled back to her previous state, I'm there.
Okay.
Hmm.
So how many assistants do you say you would have in a room with you during a birth?
I have a surgical tech that assists me with the actual delivery. There is a nurse. Sometimes there are two nurses for the patient. There is also a nursery nurse for the baby. So there may be about four people in the room, but for direct assistance to me, usually just one.
Okay. So how often would you say call?
I am on call approximately once every 6 nights and once every 6 weekends. But that depends on how many people are in the call group. So if there are four people, then a doctor would probably do one night of call a week or and one weekend every 4 weeks. But that varies. Some doctors want to be on call for themselves the entire week and then just alternate the weekends. So I think it just depends on what kind of call group you are in and what those doctors' needs are.
So it's like if you're working with people, almost like you work with other OBGYNs and you take turns, kind of, a
Basically,
little bit.
absolutely. So I'm going to give an example of call. So tonight, if I'm on call, well, tonight is Friday, but we're going to pretend it's a weekday. Um, I'll be on call tonight. I will deliver my patients and my call partner's patients. Tomorrow, they're going to do the same for me. That is that's good and bad because an OBGYN wants to always deliver their own patients all the time, but that is impossible. So we have to sacrifice that.
Alternate.
Yeah, and just and our patients, they understand that they may not get their doctor, but most of the time we try really hard.
Oh, that's good. How long do you spend in prenatal care visits with expecting mothers, like obstetric
So for our pregnant
appointments?
patients,
Yes, ma'am.
that can vary too, but on an average, about 10 or 15 minutes.
And you just kind of check to make sure everything's okay, that the baby is.
Yes, I have to make sure that she's okay, the patient is okay, and the baby. So a routine visit, I will check her vital signs. We will listen to the baby's heart tones. We'll make sure the baby's growing well by checking the fundal height. I will address any concerns and questions that the patient has, and I will advise, depending on her gestational age, what what she needs to do, what maybe she needs to be thinking about, that kind of thing. So I think it varies how long we talk. I am a talker, so my visits may be a little bit longer sometimes, but on average about 10-15 minutes.
Do you normally get a lot of calls from the mothers, like maybe just phone calls saying, "Oh, well, what's going on? I don't understand."
Yes, and we welcome that because I believe that the more you know, the more you know. And there are no, like your teacher would say, there are no dumb questions, correct?
Yes.
So that's what I tell my patients. For for first time moms, it's totally expected. The more babies you have, the more you know, so the more comfortable you are with this little pain. And oh, Dr. Taylor, what do you think about this? And I read this, and so yes, we know that that's going to happen. But my mother
Just
that's having her fifth baby, she may not call me unless she really has to.
I understand. How do you handle high risk situations in the birthing room?
In the birthing room, well, there are. This is why you train because we are taught not just how to deliver in a normal situation, but in emergencies. I think that's probably what you're asking. There are obstetrics can be very unpredictable, and things can go awry really quickly, and it can be very serious to the point that it puts mothers' lives in danger as well as babies. So we train for those situations, really. And you, that's why you read, that's why you do drills, and you can do drills with nurses so that everyone knows what a postpartum hemorrhage, what's going to happen. If Dr. Taylor says this is a shoulder dystocia, things should happen a certain way. So we are trained, and we hopefully we don't like those situations, but if they come up, then
You're
we have
prepared
to
for it.
absolutely we have to know how to do it.
Would you say that when you're executing these do they happen a lot? Do they are they common?
No,
No,
no.
that's good.
And if you talk to a group of women, everyone is going to have a story about their friend, their aunt. Oh my God, let me tell you what happened. Let me tell you what I heard. But uh, we there are a lot of babies that are born at my hospital, and if you put all of those women in a group, that the number of the emergencies and the real serious things, that number is going to be very small. But of course, you're always going to hear the bad things that happen, or oh my God, guess what? So, but no, that number is small, so we don't see it a lot.
How do you feel about inducing labor, and do you do it often?
I do not routinely do inductions unless there are indications, maternal or fetal. But I believe that you should let things occur as naturally as possible, and unless the baby is it just will not come, or the mother is really overdue, or there are other medical indications, then yes, we will induce. But I like nature to take its course if possible.
Okay. Well, what's the general cutoff for waiting for baby to come naturally? Or how long would you wait personally
I wait,
for a mother?
if everything is going fine, then 41 weeks, 1 week past the due date. That varies. Some obstetricians don't go past the due date. Some wait almost 2 weeks past the due date. When I was training, that's what we did. We waited 2 weeks. But on average, in this community, about 41 weeks.
Is there a particular reason why you would make it longer or shorter?
Once I can tell you, humans are just creatures of habit. Once you start doing a thing, something a certain way, then you just tend to keep doing it. But if my patient just begged me to go one more day or 2 more days, as long as the baby is fine, I'm okay with that.
Okay. Well, how often do you see mothers after birth?
It depends on how they deliver. If they deliver vaginally, I will see them between 4 and 6 weeks postpartum. If they have had a C-section, I see them more frequently because C-sections are surgeries, and we treat them as surgical patients. So I will see my surgical patients about 3 to 4 times.
Do you take care of the babies after the birth by doing required screening tests and
No, I
other
leave
things?
that up to the pediatricians and their staff. We are basically responsible for the mother once the babies are born. There are a
And then
whole battery of people that can do
the
all that.
I forget the term that you use for the nurses, but they take the babies after they're
They
delivered.
do,
Oh
they do,
no.
and they do all their little things to
Aw.
those babies.
I remember when I saw my sister with my mother, we went and we watched the nurse do all this stuff, and she was just flipping the baby over, and I thought it was so
I
cute.
know, because they do that all the time. They're like dolls.
um, do you encourage that your mothers take childbirth classes before they go through this whole process?
I don't require it, but I definitely recommend it. It's important to know what to expect when you are pregnant and you're going to have a baby. For first time mothers, I really recommend it because there's a lot of angst and um, nervousness around the whole labor and